Canada finally has a province willing to stand up against the madness of endless lockdowns, media fear-mongering, and irrational paranoia when it comes to COVID-19. I'm Candice Malcolm, and this is The Candice Malcolm Show. Hi everyone, thank you so much for tuning in. So you probably saw this news last week. Alberta announced that it was lifting many of its remaining COVID restrictions, including forced quarantines and mask mandates. So Alberta's chief medical officer, a woman named Dr. Deena Henshaw, announced the province's new approach to the virus last week. She noted that Alberta will be dropping the forced quarantine requirements for those who had close contact with a COVID patient, and that later this summer they will drop all quarantine mandates and many mask requirements. So in other words, they'll start treating COVID much like any other airborne illness. When you get sick with the flu, you stay home. Not because of some government mandate or government law forcing you to stay home, but you do, simply out of an abundance of caution, out of respect for others, and out of common sense. The government does not need to legally require you to stay home when you're sick. People do that on their own. People do that for every other illness, regardless of how severe the symptoms are or how contagious it may be. And while most Albertans probably let out a sigh of relief about these new changes, these measures were quickly condemned and demonized by the usual suspects in the authoritarian left-wing lockdown crowd. Check out this interview, which was plastered all over CTV News' website with the headline, "Who Does This to Their Own Public?" featuring an angry emergency room doctor who apparently wants Canada to stay locked down forever.
We're so confused as a population, like they're not going to be putting any protections in place and they're not going to be testing for infections, and they're going to let people with COVID walk around. Like when I tell people this story, their faces dropping, like, that's not possible. You're lying to me. They can't be doing this. And I think it's this sense of incredulity that the people that are in place to protect Albertans are actually trying to make us sick. We're very confused.
Doctor, the Premier is saying that the cases no longer equal high levels of hospitalizations, that the focus needs to be more on vaccines.
We don't know that. We don't know that. Nobody's ever gone through a cycle of complete relaxation of restrictions through Delta. Nobody. It's insane. It's this incredible experiment to see how many people we can get sick, have long-term disability, and possibly die. Like, who does this to their own public? Who does this? Like, what the hell?
Why was he wearing his ER scrubs? He was doing an interview from his own living room. I didn't get that. Well, anyway, this person's voice apparently is the voice that the media wants us to be listening to. And while countless journalists were expressing similar anger and outrage at the province of Alberta and at Chief Medical Officer Dr. Deena Henshaw and at the province's Premier Jason Kenney, and generally against the leadership in Alberta, some journalists took their aim directly at the people of Alberta. So this is Dale Smith. Dale is a freelance reporter who is based in Ottawa, and he is a member of the Parliamentary Press Gallery. That's that very exclusive club in Ottawa that gets all sorts of unprecedented access to politicians, and they get resources. It's a very exclusive club, and we're told it's only for very, very serious journalists who do very, very serious reporting. Dale is one of them. And so when he was trying to explain these measures to people who aren't from Alberta, apparently Dale is from Alberta, so he was trying to explain these measures to others. This is what he said. Now, I included this in my Toronto Sun column, and some of Dale Smith's friends or his fans on Twitter were accusing me of taking it out of context. So I'm going to read the entire Twitter thread here, just so that I'm not accused of taking it out of context, and I'll let you decide for yourself what he's saying. So the thread started this way. Supriya, who is a journalist in Toronto, she's actually fairly reasonable, or at least she used to be prior to COVID. She tweeted this out, and she said this: "I need someone to explain Alberta to me. Ryan Jesperson, you up for the task, buddy?" Ryan Jesperson is a former left-wing radio host up in Edmonton. So Dale Smith replied to this tweet. He said, "What do you need to know?" Supriya says, "How does a province that has currently experienced this then decide to go ahead and do this while having the second worst vaccination rate. And so currently experiencing this, I guess, is talking about how there's the spike in the Delta variant, and then they decided to go ahead and do this, which is easing up all these lockdown rules. So this is what Dale said in reply. I'll read all the tweets again, just so I can't be accused of taking it out of context. So he says, "The first thing you need to know is that Alberta was initially largely settled by Americans, that they are God's chosen people, and that it's their hard work and ingenuity that put the oil in the ground, and it's their hard work and ingenuity that pulls it out again." He goes on, "With that in mind, they are more concerned about individual freedoms than the collective good. It's also why they are more concerned about low taxes and socking away resource revenues in sovereign wealth funds and preparing for the future. It's why, like Americans, they are more concerned with ending restrictions and masking than they are with actually combating the virus. That Hinshaw was shrugging off allowing it to become endemic because it would take too much human resources fits into these priorities." So there you have it. I won't add any commentary to what Dale put. He clearly has a pretty negative view of Albertans, which he compares to all Americans, even though clearly America is a very vast, broad country with lots of different people with lots of different views, and the province of Alberta is settled by a lot of different people from a lot of different backgrounds. That aside, that kind of gives you a little bit of a window into the way that the mainstream media views Albertans, but also views Dr. Henshaw, the chief medical officer over there in Alberta. So while left-wing journalists were doing their best to demonize the province, Alberta Premier Jason Kenney pushed back against these agenda-driven lockdown advocates in the media. This is what Jason Kenney had to say about the media and their constant fear-mongering about COVID.
We have seen the numbers come down dramatically in Alberta. We should salute that. I think it's time, Frank, let me be blunt, I think it's time for media to stop promoting fear when it comes to COVID-19 and to start actually looking at where we're at with huge vaccine protection. We have crushed that third spike. COVID continues to exist. As I've said before, the virus will continue to circulate. Numbers will go up and they'll go down. But what matters most is that the widespread protective effect of vaccines is real. We should embrace the science.
Hear, hear. But it isn't just the media and it isn't just the crazy activist doctors they promote. Left-wing politicians also wanted in on the action. So Calgary Mayor Naheed Nenshi similarly just lost his mind over the idea of having to live with COVID. He says this, "It's inconceivable to me. It's the height of insanity," he said about Dr. Hinshaw's decision to no longer have that government-mandated forced quarantine. So many of the fellow travelers of these left-wing journalists and politicians decided to organize their own protest. This is what that looked like. These people are actually protesting for more government intervention. They're against government easing restrictions, so they went out there to demand more government control in their lives. Can you imagine? And remember how the media treated the anti-lockdown rallies? They called the protesters COVIDiots. They painted them all as far-right, sometimes even white supremacists. They ridiculed and mocked these protesters for daring to speak out against the lockdowns. Well, this is how that same mainstream media treated the pro-lockdown protesters. This is a tweet from a global news reporter. She says, "A growing crowd at a rally in Edmonton spurred by Alberta doctors. Participants say they came here today to protest the province's changes to COVID-19 measures. The event in Edmonton mirrors another one in Calgary." So really she's just sort of saying, these people are guided by doctors. They're guided by doctors. And also it's a growing crowd. So you can see that they have the media on their side, cheering them on. And really, it's remarkable, folks, how much the tables have turned. I'm old enough to remember, 3 months ago, when these same left-wing voices were hectoring the anti-lockdown crowd for daring to criticize the all-knowing public health officials. But now that a few of those public health officials have changed their tune and decided to ease up some of the lockdowns, that authoritarian lockdown crowd, including politicians like Naheed Nenshi, including activist journalists like Dale Smith, well, they've given themselves permission to condemn the same experts to their heart's content. Remember, when you do it, it is vicious and undermining trust, public trust in our system. When they do it, though, it's perfectly reasonable because they're fighting on behalf of what? Safety for all? Who knows? It must be nice to believe that you have the moral high ground no matter which side of the position you take. The global COVID pandemic and the ensuing lockdowns gave these busybodies a taste of unlimited power and control, and they liked it just a little bit too much to let it go. Ironically, by demanding more restrictions now, even for fully vaccinated Canadians, these left-wing doctors, journalists, and politicians are actually undermining the case to get vaccinated. The reality is that according to data from the Public Health Agency of Canada, the COVID case mortality rate, which really is the only thing we should care about, we shouldn't really care about the number of cases. There would never be a news report reporting on the number of flu cases because it doesn't matter how many people get the flu. What really matters is how many people die from the flu. And so when we're looking at the COVID case mortality rate for patients who have had one dose, the death rate is 0.0027. And for those who have had two doses, those who are double vaxxed, the death rate is 0.0018. You get that? That's about on par with the seasonal flu. In fact, the National Post had a very handy article today showing you all the things that are more likely to kill you than COVID-19 if you're fully vaccinated. And this includes car crashes, the flu, late-stage cancer diagnosis, Parkinson's, diabetes, and hepatitis. All of those things are more likely to kill you than COVID if you're fully vaccinated, and yet you have all of these activists demanding more lockdowns in Alberta. It is completely absurd. Compound the very low risk for vaccinated Canadians of dying from COVID with new information about the drastic impact that lockdowns had on mental health and the well-being of Canadians, and it makes Alberta's new approach seem like a slam dunk. I'm talking about a recent Statistics Canada report that showed that more than 4 times as many working-age Canadians died because of the lockdowns than because of the virus. So this is according to StatsCan. Between January 2020 and April 2021, 5,535 Canadians under the age of 65 died because of the indirect consequences due to the pandemic, while 1,380 Canadians in the same age group during the same period died from COVID. The lockdowns were deadlier than the virus for most Canadians. It's time we stopped listening to the left-wing lockdown authoritarian crowd and started living our lives. I'm Candice Malcolm, and this is The Candice Malcolm Show.